In a big picture, the issue is whether you're going to replace the entire joint. That's called a total joint replacement. That would be both sides of the joint. So in a shoulder, that would be the ball and socket. In a hip, that would be the ball and socket. And in the knee, that would be tricompartmental or three-component replacement of the kneecap, the thigh bone, and the shin bone. So three different parts. Joint replacements are sophisticated enough that you can replace any one of those sides of the joint.
Depending on what part of the body we're looking at operating on, the most common joint replacements are the shoulder, the hip, and the knee. Knee being the most common joint that we typically replace in the United States, there are actually several different options when it comes to knee replacement. Now, a lot of them have to do with still replacing the joint. It's just how do we accomplish that? And so one of the options is a partial knee replacement. Partial knee replacements, they came out because a full knee replacement, there's about 15 to 20% of patients are not fully happy with their knee replacements. And that's a statistics that it really is discouraging for surgeons. And so we started looking at other options to try to give people improved function with a more natural feeling knee. And that's where the partial knee replacement came into play. The partial knee, though, is very specific on the criteria who will benefit from it. You really have to have isolated arthritis either on the inside of your knee or isolated on the outside of the knee. Kneecap really cannot be involved. And so those are the patients. There's also a weight limit, there's an age limit, there's a bone quality that we look at. So the partials, it is more narrow, the patients that will qualify for it, but it's one of those that absolutely is an option.
So shoulders are different. Most of the shoulder replacements are rehabbed and treated very similar to a more involved arthroscopic, like rotator cuff repair. You can go home the same day of surgery. They often do a thing called a nerve block, where anesthesia injects you just above the collarbone and makes the arm numb for 12 to 24 hours, which is wonderful. You don't require as much anesthetic. Very good pain relief during that stretch. So we can manage virtually all shoulders as an outpatient. It is a little more restricting in that because of the tendons that have to be detached and then reattached to get in there and do the work, you have to be protected in a brace or sling for 6 weeks typically to allow that soft tissue to heal. So you are to some degree a one-armed person after that. Your hand is free to write and type and hold things, but you can't take your brace off and just use your arm in a normal fashion or you're going to undo some of our work.
We look at hip replacements. Three common ways to get into the hip. One through the back or a posterior approach. About 65% of the surgeons in the country are still doing the posterior approach. The disadvantages of that, it has a little higher dislocation rate. You do have to cut muscle off a bone, which slows down your function and your recovery for a while. You've got the lateral approach also, and through the side of the hip, same thing. We take down muscle to get into the hip, slows you down a little longer. Recoveries takes a little bit longer. And then the last one that less surgeons are doing, but it's one that really has a higher functional outcome out of the gates. The first 6 to 8 weeks, you have a lot of improved function with the direct anterior approach, and that's what we call a minimally invasive approach, and it's going through the front of the hip. And that one, we're really splitting muscles and dissecting down to the hip joint, but we're not cutting the muscles off the bone. This helps people recover quicker, helps to improve function. And so it's a approach that's not for everybody, but it's one that definitely has the potential for a little quicker recovery.
Our ideas behind surgery and what recovery is are changing. Our ability to control pain and increase function quicker is changing. So I think more and more people are going to start being candidates for outpatient surgery. But right now I think we need to really proceed with caution on that because we need to make sure our patients are going home safely. We can't just be operating on them and sending them out the door if they don't have the right support system at home to have a good outcome.
Technically, outpatient surgery means you go home the same day. And inpatient means you spend at least a night in the hospital. When it comes to the joint replacements, it's more technical than that. So unless you meet specific criteria due to various medical issues, it's considered outpatient, and you still end up most of the time spending the night, but you generally have to go home within 24 to 48 hours after the surgery.
So I think the ideal patient for outpatient surgery for specifically hip or knee replacement is one that doesn't really have any medical problems, maybe one or two that's very, very well managed. They have a great home support system where their husband, wife, spouse, significant other, children, or friends, family can really take care of them and spend at least 1 to 2 days with them minimum to make sure that they can take care of themselves at home. They need to make sure that they have appropriate transportation to and from their doctor, to and from the hospital, and most importantly, to and from physical therapy. Also, they need to make sure physical therapy is ready and available for them. You know, someone who lives in an area that maybe doesn't have a therapist that they can go to might want to reconsider that option, because if you can't get to a therapist, how are you going to make sure you have a good outcome from your surgery?
I think it's worth it when you get to a point where your function has deteriorated so much that you no longer engage in the things that you enjoy doing. You know, when you're almost housebound because your arthritis has crippled you that much, I think it's well worth looking at and exploring the options for joint replacement surgery, because it absolutely can restore function.